Welcome to Serenity Rising, Healing with Cancer. I'm Bron and I want to welcome you to not just a podcast, but to a community, a new way of seeing, feeling and walking through the chaos of cancer. So welcome, Kate. It's wonderful to have you here on Serenity Rising.
Thank you, Bron. I'm so excited to be here.
How the heck did we get here on a podcast talking about living through cancer? So tell us a little bit about how you got here.
Well, I think it might have been through our mutual friend, Joe. We have become friends. We're both sort of health practitioners, and Joe has set up a sort of annual gathering of some women in Sydney. So all of these women have had breast cancer. So I think may have come. I came to you through her.
You did. And, you know, you grew up with a huge family. I was just reading your bio, 13 children, your parents.
Yeah, I know. It was pretty epic.
It would have been epic, and it's the resilience. So if it's okay with you, in terms of the context of the cancer and how we got here, did you think that resilience has helped you come through what you've been through?
I think so. My dad was a GP. My mum was a nurse. So I suppose I've always been around health things. And as youngsters, we used to work in dad's surgery. So I think I started being the secretary, which I thought was terribly important.
Well,
age 12. Well, it is. At age 12, because I think you do grow up when you have so many people, so many nervous systems in the one house, you are put in a position where you have to kind of develop some strategies to get along most of the time anyway. But I have 4 sisters, so we all kind of did a bit of work in the surgery with Dad. We would go and do house calls. We would go and visit people, in hospital. So I think I was exposed to the challenges that people face with their health from a very early age.
Do you think that's what brought you into science? So tell us a little bit about how you got into science and your background, and that's going to lead very clearly into where we're going next with this conversation, because you did have that exposure, which that would be an exceptional, but also interesting, shall I say, at a young age.
Yes. I think I was always a curious child. I was always had my head in a book. We used to have these World Book encyclopedias, and they had pictures in them. So I used to like to take one to bed and sort of open it up, see what was on the page, and then close it and then open it up at a different page. So you can imagine when 13 people in our house, it was pretty hectic. And I think books and learning about the world, it was almost like the book was a portal out into the wider world. It was a bit of a respite, I suppose, from the sometimes chaos in the house, to find a quiet corner and just kind of go off. But I think there was certainly curious by nature, but I like to help people. I've always been a very empathetic person. And I think I wanted to do something in later life that there was a lot of people pleasing. I went into it perhaps with good intentions, but they might not have been my intentions, but I didn't realize that at the time.
No, because it was in. So tell us a little bit about the science, because obviously in your welcome we've talked about you getting into medical science and blood banking and tissue pathology,
Yes.
Which means that you would have known all about what happens to breast tissue when it gets examined.
Yes. Exactly. So I started life as a medical scientist. I started at Pathology, to sort of routine tissue pathology, skin biopsies that you might have removed at the GP or at the dermatologist. So from there, I went to work at the Alfred Hospital, and they also had those sorts of things, but they also did a lot of transplant pathology. People who have had a transplant need to have kind of monitoring for the first little while to make sure the tissue is not being rejected. They also did a lot of autopsy work there.
You did say that in our chat about the forensic work that you did.
Yeah. So I did some at the Alfred, which was, more routine autopsies. But I also I went to work at the Forensic Institute in South Bank. So that was perhaps more not as routine, but, autopsy material. So there, and I also, when I went overseas on a science exchange to work in a teaching hospital in the UK. So they did a lot of teaching pathology to medical students, but also they did a lot of, because it was a big kind of county hospital, they did a lot of paediatric pathology, which I hadn't, or paediatric autopsies, which I hadn't really ever been exposed to before.
Wow.
So it was the registrar who I was working with, he was actually Pakistani, and he said, I want to learn as much as I can about why children don't survive so that I can go home to my own country and do something about, we have a high infant mortality rate. I want to do something to, change that. So I guess I learned about the power of pathology, understanding, why do people arrive at this point, whether it's disease or death, how do people get there? What kind of things? How can I look after myself? How can I look after other people to live a healthy and happy life? I mean, we're all going to arrive at death at some point, but how can I maximize my health span and my lifespan in between, so that, I live a full life before that happens?
I love it. So coming through all of that and then going into remedial massage and then into osteopathy?
Yes.
It's to come through from literally one end of the gamut to the other, and then with the diagnosis of breast cancer. Throughout your time there, and we're going to dig into that a little bit more, but when it came to finding, I like to ask, so my word's Serenity, yours won't be. We've had all sorts of different kinds of words. So when I say to you, what's your Serenity? What's your thing? I'd love to hear more about that.
I'll backtrack a little bit. As a health professional, so focused on the health of others that when I found the lump in my breast, I didn't actually really think anything about it because I was so focused on living this healthy life. I was like, oh, it's probably nothing. I took myself off for a mammogram where I actually was working next to a breast screen clinic, and the mammogram was reported as negative. And I was like, great, tick, didn't think anything more of it. Went to my GP a few months later about something else and said, oh, hey, I've got this breast lump. It's been reported as negative. She sent me off to have an ultrasound, which was reported as suspicious, and then to have a biopsy. Yeah. And she said, go straight to the surgeon to receive the results of the biopsy. And I'm like, that's odd. Why would you do that? You haven't even got the results yet. You're making a big deal out of nothing.
Literally, you've had the biopsy and then you're going straight to the surgeon?
Yeah, I'm still quite not quite clocking what's going on here.
No. What's she telling you without saying?
Yeah. Well, she didn't, probably didn't want to cause me any alarm.
No, of course.
But I rock up at the surgeon's office on my own thinking, can remember standing outside going, how long is this going to take? I've got so much to do.
So you didn't even have a think about what
I didn't even
might be coming out of that doctor's mouth?
No, it was not even a thought bubble, which it makes me laugh now, but I feel a bit ill when I think about what happened afterwards. So I come out of the surgeon's office and he's just told me it's malignant and it's high grade and I've booked you in for surgery next week. And I rang my best friend and I said, you need to come to my house and you need to come now and you need to bring lots of gin with you. And while I was waiting for her, took me less than an hour. I'd shut down my practice for a period of 6 months. I'd rung some of my colleagues to ask them if they'd be happy to take some patients for a short period of time. And they were like, load us up. But it's amazing how you can be this busy professional and then all of a sudden you receive this news and it's like instant perspective. So it's amazing how fast things can move when you decide that, this is an important thing to focus my attention on. So I didn't really have much idea that this was coming. And in the surgeon's office, before he knew that I was a medical scientist and that tissue pathology was my thing. And I wanted to go through the report with him with a fine tooth comb. But I said to him, are you happy for me to just put my phone on record? Because, my brain's not really working that well at the moment. No. So we did that. But, going through the pathology, it was very different. And this might play into what we sort of speak about a little bit later, is you can have all of this knowledge as a scientist and as a health professional, and all about the academics of it and the words on the paper, and that's good when it applies to someone else, but it's a whole other experience, when that applies to you, that it suddenly becomes a very human experience. You're not in your professional role, but there was just this kind of almost the shock, it seemed academic that he's not actually talking about me. I'm having this discussion, but it was all academic at that stage. And I think starting all of the process that is treatment for breast cancer, it was, I think I went into full health professional management mode
Yes.
to get all the things done and make all the appointments. And wasn't until, I would say, probably even 2 years later that the reality of it landed, that crap, that, because I was diagnosed right about a couple of months, like in end of October 2019, just before the pandemic started, really sort of ramped up. So I had to go through it on my own. I was in metropolitan Melbourne, and for anyone who's listening, we were not allowed to have people come to our house. I had what was called a bubble buddy. So I had a one
Melbourne was
designated
the
person.
worst. Like, what was it, 200 days or something? It's level of
It was
isolation.
It was quite incredible. I had to drive myself to chemo and back to radiation therapy and back. I was in my house on my own. Like, I developed numbness like pins and needles and numbness in my hands and feet. And I can remember the light in the ensuite blue. And I'm like, I should get up on a ladder and change that, but I can't feel my hands and feet. I'm here on my own. What could possibly go wrong? So it was like that for months. I had a little camp torch. If I had to go into the bathroom at night, I had to kind of put this lantern on, because I'm like, there's no way I'm getting up on a ladder when I can't feel my hands and my feet by myself.
Kate.
So
I know the pain from the neuropathy and exactly that. And it's to be on your own with a torch just brings it all to perspective, doesn't it?
it does. But I think when you're in that situation, people say, oh, you're very brave. And it's like, I didn't really have any other choice to do that.
There's no choice, is there?
We have to do what you have to do when you have to do it. And it's perhaps not until after the event that the magnitude of that really lands.
Yeah. And it lands hard. And I think that's part of where this happens. So during that whole time, did you feel that you were playing to the science or that clinical space? Like, I know myself, man, I just go to clinical and they think Bron's doing so well. That's because Bron's faking the living crap out of what's going on. I'm pretending I've gone into, I'm the machine and she looks amazing. But there's no connection to me.
Yeah, there is. I absolutely felt that. I think it was a safety mechanism to feel like I had some control over something that I didn't really have a lot of control over, and to try and create some certainty where there didn't really feel like there was any, either with the cancer or with the pandemic or going back to work or, what the hell was happening in that period. So I think I wanted to be able to help myself and to give myself the best outcome. And I'm fortunate and thankful for the knowledge that I did have, because I thought, I'm only going to get one shot at this and I'm just going for broke. So I also had an oncology naturopath that I consulted with via Zoom. So this lady has a very evidence-based person. She had honours biochemistry degree and a 3/4 of a medical degree in Australia before she quit and went overseas and did integrative oncology in the US. So she pretty much was.
I think I need your contact details.
Well, I'm happy to supply her details. But I didn't ever tell my oncologist about this because it was my decision. Having that autonomy or that being able to advocate for myself. It's like, even though I grew up in a medical family, health as a more general concept was important to me. So it's like, I'm going to get one shot at this. And when I finish the treatment, I'm going to have to go back to work, because at that stage, I'm still on my own. Like, had just divorced. And
wow, you got hit, didn't you? You had a tsunami.
Well, go big or go home.
Kate Caine, go big or go home.
Well, nobody.
As I acknowledge you, I want to really acknowledge this space, Kate, because
thank you.
That's a lot.
It was a lot.
And COVID. I mean, we all struggle with COVID, and you're going through breast cancer treatment. And for those of us who've been through treatment, man, that's tough. It's tough. I just want to acknowledge that.
Thank you. I really appreciate that.
Yeah.
But it is, I wanted to give myself the best chance of buffering the effects of treatment on my body.
Yeah.
Like, I can remember, I think it was after my second bout of chemo, when my hand really started to come out in just handfuls. I can remember standing in front of the mirror, just crying and apologizing to my body that I had to do this, and promising that I would do everything in my power to kind of, become the healthy person that I was prior to this. And, I'm sure many of your listeners will have had that experience. But now from 5 years down the track, my body is not the same. It is
Yeah,
not the
it
same as
is.
it was before. And there is a process of acceptance, and that doesn't mean giving up. That doesn't mean that's not an admission of defeat. That is accepting what is here now in this moment and moving forward from each moment rather than trying to look backwards and have what was there before, because that may never come.
Agreed.
Being thankful for being as healthy as I am and still continuing with my own personal mission to be as healthy as I can in any moment, but an acceptance of, what has been and what is here is here.
And what I'm hearing is the serenity prayer. God grant us the serenity to accept what we cannot change, the courage
Yeah,
to change the things we can, and the wisdom to know the difference. So
absolutely.
what's your word there? Because obviously we're talking serenity, but that's because it's not about that. I want to know what your words were and what your process or thoughts were to be able to make those to back yourself and choose what was exactly right for you.
Well,
Like you don't
that's,
know until you do it. You don't even know
yeah,
if
well,
it's
you
right.
don't,
It might be wrong, but it's still the right decision, if that makes sense.
yeah. So my word is perhaps it's an embodiment or a
Yeah.
re-embodiment. It's a really deeply felt sense of what is right for me. And we were talking before about, science is great. Science is about it's almost you have to be disembodied because it's not about your
Mm,
beliefs. It's not about your opinions or how you
mm,
want things to be or
mm,
how you think things should be. You have to step away and just be a witness or an observer to what is there, what is happening, and to the best of your ability, trying to understand what is going on without applying your own biases or your own, really kind of almost testing your thoughts. There's a guy called Karl Popper who talks about falsification, that science is not about what is true, it's what's most likely, the most likelihood to be explanation to be true based on what we have. And if you actually try and disprove yourself, and if you can't disprove it, then it is more likely to be true. So really becoming conscious of my own thoughts. Science is about gathering as much data as possible from various sources, and that can give you an overall idea or what is most common or most likely. But when it comes to somebody's cancer journey, we were talking before about n equals
mm.
1. So
Yeah, n
normally,
equals 1. That was one of my questions. Tell me about n, so N for Nelly, n equals 1, because this is
yeah,
so valid but I think so empowering,
yes.
and it's your take, and I just love that. So tell us about what that means to you.
Well, n equals 1, usually in research studies, you like to have a big population of people. So you might have n equals, 300,000. So it gives you a more realistic sample of what is going on in the community or in certain populations or people with certain conditions. So pretty much the bigger the numbers, the more valid the results. If you have a small population, it can lend itself to a little bit of bias, or it's not representative of the whole population. So generally in science spheres, big numbers are better. But when it comes to a cancer diagnosis, every person's experience, their journey is n equals 1. It's not the same. You can have as much data about women with breast cancer experience this or experience that or feel this or feel that. That's helpful to understand, to give you a bit of context, but your own experience is your own experience. When I went to the oncologist and said, my hands and feet are numb, I think I've got peripheral neuropathy. And this was like early, like maybe after the second dose of chemo.
So you're right
And
early and yeah,
well,
okay.
because of my background, I
Oh,
recognized
you'd
it for
know
what it
it.
was. Yeah.
Same with me.
And there was a bit of eye rolling, and she's like, "Oh, well, it's just part of the treatment. It's just a treatment side effect. It'll wear off. Don't. Nothing to see here." And I
Mm.
was like, "No, that's not acceptable." I said, "So what are you going to do about that?" She sort of looked blankly at me. She said, "Oh, well, I suppose I could reduce the dose a bit." The nurse in the day oncology ward also made a few adjustments, so that was great. But I just thought, if that was someone else who didn't have any idea of what was going on, to this day, the pain and the tingling has gone, but my fingertips and my feet are still numb.
Does it hurt?
So if it's cold, it does. It feels like my
Yeah, I
hands
get
are
actual
hands are on
pain on the
fire.
sides of my feet. Yeah.
Yeah.
And it's
So,
real.
and it's
So
real. And
the
the unequal,
minimizing
yeah,
of, "Oh, that's normal." It's not normal and it's not okay. It can be dealt with.
it can be
Shouldn't
dealt
have
with. There
eye
are
rolling.
things. there are things that can be done at any time to reduce the symptoms and to reduce the damage that gets caused. And what, as a health professional, it was being on the receiving end, it was a real eye-opener to how often in medicine people's experience, their complaints are, well, not even complaints, their experience is dismissed or minimized. I have a sister who was diagnosed with breast cancer last year, and she's been a director of nursing. She's an intensive care nurse unit manager. She's been a cardiothoracic intensive care nurse. She's like 40 years experience. And when she had her surgery, within the first week, she had identified that the wound was breaking down, the stitch line was breaking down, and it was infected. And she brought this up with the practice nurse, the surgeon's practice nurse, and was dismissed on a number of occasions. And long story short, it ended up with her having to go back for surgery to clean out the wound, take all the stitching out, restitch it. It delayed her radiotherapy by 3 months.
Yeah.
And
Wow.
I said to her, because, if this had been her patient or someone in her care, she would have been kicking down doors, because that's how she rolls. And I said to her, so what was it that stopped you being that advocate for yourself?
Great
And she's,
question.
there's no point railing at her because that will just
No,
make her feel
and it's not
bad.
about that, because it's the
It's not
moment,
about that.
hindsight, which is where the silver lining or the lesson can come.
Yeah. Well, you know what she said? This person who's been around hospitals, who's for all of her life, is the most fiery redhead I think I've ever met. She said, I didn't want to be a difficult patient, from a health professional, about how difficult it is to advocate for yourself in that kind of environment, because you don't want to be. And I think perhaps more as women, our pain is dismissed, our concerns are dismissed. You're being a bit hysterical, you're being overly dramatic. It is not okay. And I think that was, we talked before about sort of masking, like everything's fine, I'm really positive about this experience and all of that sort of stuff. I've only recently discovered that I have ADHD and I'm a bit progesterone sensitive. And I also probably have a few autistic traits. So, but given my family background, being a health professional and having ADHD, I am like expert level, genius level masker.
I was about to say, you'd be queen of the show.
Absolutely. Like you wouldn't. And, I think, with 8 brothers, especially when you're playing games or, at the dinner table, you've got to have your poker face on. Don't let them know what you're thinking, because, if you're trying to maneuver to get a second helping of something, or, you're playing cards or playing chess or doing that, you learn to have a pretty good poker face. But it was a real lesson for me, both that experience of breast cancer, like other people are making decisions about what's happening to my body, and I have to be part of this. And there were things that, there were certain things that I wasn't on board with. I actually interviewed 3 oncologists before I decided which one to go with. One of them frightened the crap out of me, and I trusted my sort of intuition at that stage, and when the lady that I did decide to go with, when I had documented all of the stuff that they said that they wanted to do, because I wanted to compare who was going to do what. When I said, well, this guy said he was going to have this combination in the chemo, there was just this kind of, her face expression changed. Like she looked a bit shocked, but she masked. I later found out that they don't use those drugs together in the States anymore because it causes damage to the heart muscle. So asking questions, being your own advocate is so important. Like this is not just happening, this is not just happening to you. You can help make it happen for you. That asking questions for more information or choosing to say no to something, they're complete sentences. So you're not being a difficult patient. You're not making the doctor's life difficult. Their job should be to work towards the best outcome for you. And, we spoke about a colleague of ours who, some of those drugs she really had a bad reaction to. And it's only a helpful treatment if people can tolerate taking it.
Exactly.
So being open
you don't want
to
to die
all
the
options.
treatment. That's not cool.
I know.
It's not cool.
Kind of defeats the purpose, really. So
it completely
I think
defeats the purpose. And I just want to hit the pause there, because I think I just want to make sure our friends who are listening to understand the strength of what you're saying, which is to ask questions, to be an advocate, but to listen to your own body. It is your body. And if you don't understand, it's okay to not understand. It's taken me until this year. So remembering I started treatment in 2017 and then again in 2023. for 2 different cancers to now to go, I'm asking questions, and I know that when I walk in, they go, "Oh, shit, here she's again,"
Yeah.
and it's
Here
more,
we go
but
again.
they have respect for me, right? But it's more around, I understand that if I don't ask something that is right for my body, my brain, my heart, my health, if I don't, no one else is going to ask, but I'm the one
No.
who's going to have a consequence. So
Yes.
it's that strength
Indeed.
of finding that. That's what Serenity is about, is having the courage,
Yeah,
and no question
absolutely.
is silly. And I
No.
love the fact that you interviewed these people. Man, I was too terrified. Oh my God, they're doctors. I was terrified. But I must admit, I did go to Sydney and I did start my treatment in Sydney because I wanted to continue that treatment when I came home to Port Macquarie. I must admit, I did do that, but I had that understanding because I didn't know what I was in for. And you don't, even now, you don't know what's coming next. I think that's part of the uncertainty. You don't know what's coming next. But I love the fact that you're saying, pause. You're not saying no. You could be saying no, but you can also be saying not yet because I need
Yes,
more
indeed.
information.
Yeah. And that there is, until you are fully aware of the pros and cons and how it might affect your body, like there is no certainty. None of us know how our N equals 1 is going to react to that thing, no matter what the data says. But
And
you can only, sorry, carry on.
yeah, I was going to say the scientist, guys, listen here to the scientist who knows the N equals 50,000 N equals 1. Kate, I just tell you how incredibly powerful that is for someone who doesn't or hasn't been in science to just take N equals 1. 1 is me.
Yeah. Yeah. And it is, all of those 50,000 are N equals 1. Collectively, they give you a perspective, but it's not fact. It's not truth. It's an acquired understanding. And there's always going to be variations to the rule. And making the best decisions, being comfortable to move ahead at any stage of the treatment with feeling that you've made the best decision possible for you, that is an important part of the healing and the treatment process. Whereas if you feel dismissed and like you're just on the conveyor belt, that is not going to bring you perhaps the best outcome. It's a collaborative process, and it's important to you.
Well, your life depends on it, doesn't it?
Well, it does. People in hospitals, you might be their 25th, 25,000th patient that they've seen this person go through, to go through this process. But this is your first time, hopefully your only time. It's fucking scary. It is fucking scary when, like, I remember thinking about the chemo, like my hair is falling out like that. The level of toxicity or what it must be doing in my body to make that happen. Like, you wouldn't voluntarily go, yeah, I'll have a crack at that. Like, you'd have to be in a position where to make that decision to do something that is potentially going to cause hopefully only temporary harm to you to get a better outcome. You have to really be invested in the decision. So
I agree.
ask questions.
Ask questions. And guys, this isn't about what treatment type you choose. This is, as I always say, it's not an either or an or, it's an and.
Yes.
So whether you're anding, I spoke to a beautiful woman earlier this year who's managing her multiple myeloma using all natural methods. And the point isn't about the cure, it's holding her where she is. And that is just so exciting, because she's terrified of a stem cell transplant. But guess what? Treatments are changing, and she may not have to go through that because her bloods are holding. So it's not an either and or for us. We've done an and, because you've got your naturopath and making the decisions that you've made. But that's the whole point, that you made them because they were right for you.
Yes. And seeking lots of information, lots of viewpoints can really help to balance your understanding about pros and cons and realities versus suppositions. That there's lots of information out there that is not based on any kind of science or even common sense. It is just something that they have taken that information and either misunderstood it, or they've had a different, like a really kind of, when you ask them to explain what they mean by that, they struggle to do that. They are just perhaps repeating something that someone else has said, but they don't actually have an understanding of what the basis of it is. So be discerning where you get your information from, but seek to understand the pros and cons before you make your decision.
Yeah. And that's why we call it the science and the soul, because you're thinking they're normally not in the same sentence, but they are. There's science and
Oh,
there's soul.
absolutely. It has
And
to
I
be.
talk about perception versus perspective. We're talking perspective here. Perspective is based on evidence. When, you can go and see a medical professional and they'll just literally put their line in the sand and go, well, that half, there's no evidence. There's evidence, but it's more about the perspective versus, don't go to TikTok. Just saying, just please don't go to Insta. Go and see, but please, as you say, do your research. And I know that for myself, I was not capable of researching, thinking, how could you not, Bron? You're a nurse educator. I couldn't. To this day, I've minimized my research because it scares the bejeebers out of me. But
Yeah.
I'm not foolish enough to say disregard. We don't disregard anything, but just be very discerning of where you find your information and what is right for you. That's the whole point, is what's right for you.
Yeah. And when you receive a diagnosis like that, your brain's probably not going to function that well. It can be overwhelming. You're like, I'm a scientist of 30 years experience and my brain was just like, I drowned in facts. And I also had to pull myself back a little bit and pick and choose what I wanted to look at. And really, you can only make your best decision. And that is the right decision for you based on, the tenets of evidence-based medicine are the data, desires. It is a blend of all three of those, and it should be a collaborative process.
It is a collaboration. So that's exactly what we're saying here, guys, is the collaborative. We, the patient, are having as much as a say to be a part of the conversation at the table versus
You've got massive
the
skin in the game.
You've got
you've
skin
got
in the
a
game,
lot of skin in the game.
And, I'm very good at playing clinical card, and the clinical card is not the one that is most important to me. I'm going to let you know that, here I am in hospital with a stem cell transplant, and I'm, these beautiful people are coming and talking to me because they knew that I was an educator and blah, 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 blah. And I felt almost disembodied from the horrific experience of what was happening to me when your white cells are brought to zero and you have no white cells for a couple of days. And I'm going, okay, this is cool. We're right. And you are not okay, Bron. What the hell are you saying? Do not tell them you're okay. And I'm like smacking myself inside going, don't be ridiculous. And that was part of my experience, which is why we're having this conversation in the first place. So in the fact that we have to be self-advocates, but also have the understanding that if you don't know the answers, we're going to find someone who does. Like, you're an ideal person to find that information and share that. Now, one thing I do want to just cover before we wrap up is you've mentioned when we were chatting about a previous mentor and around the contemplation of death, and that it's a beautiful invitation. And we're not talking about,
we're not talking about planning your funeral.
No, we're not talking
That's
about what
not what
songs
we're
we're going to play
talking
and what flowers you're bringing.
No.
But we're talking about a topic that people don't like to talk about, which is death. Just remember, there's only one way out of this world, people, for every single one of us. But I'd love to hear more about what your perspective is around that. What do you mean?
Well, I think having lived through the experience of cancer, and I'm thankful for that, but also my experience as a medical professional, the child of a medical professional working in forensics, I think I've had a lot of exposure to death. So it doesn't frighten me in the way that it does some people. But to contemplate your death means to, almost step back as a witness and perhaps see yourself at the moment of your death or, the weeks leading up to your death, and to think about what memories would I like to have created with my family, my friends, my colleagues. What will be an important kind of, you can call it a legacy or, a footprint that you might want to leave behind for them. What trace of myself am I going to leave with my kids or my husband or my wife or in my family? How would I like people to remember me? How would I like them to think about me in years ahead when I'm not there? How would I have liked to have affected them? Maybe I, catalyze them to do something, or like I compel them to do something because of what they remember about me or having known me. And also, what is it that I personally want to leave behind? Like we're not all here for a long time, some of us longer than others, but it is a finite amount of time. And often when you put things off, we get caught up with the busyness of life, and that is as it is. But when you contemplate your death, you start kind of thinking about how you want to be remembered or how you want to have lived versus how you are living your life now, and what needs to shift to create that reality that when you arrive at the moment of your death, the things that you want to leave behind for others, the way you want to leave others behind, supported mentally, physically, financially, emotionally, free to kind of move on with their lives post you
Mm,
and be in a beautiful, supported way, like holding you lovingly rather than grief stricken and paralyzed. I
yeah,
have seen people who spend 40 years mourning for that. Their life stops when the other person's life stops.
yeah,
It is a beautiful invitation to contemplate those things and think about both your own life and the lives of those around you. How are you all going to move forward towards that point? So it really does give you pause for thought. I'm working on a project, like having found out I have ADHD. That is a factor in probably how the treatment affected me or why it hit me so hard in a lot of ways. It makes sense of a lot of the context of my life and of our family. And it is now something that I feel compelled to take with me to do something. There's lots of work with children who have ADHD and other types of neurodiversity, and that is as it should be. But often
yes.
people who are late diagnosed, often in perimenopause, menopause, it's kind of like you get the diagnosis, maybe you get some medication, and it's kind of like, oh, well, you've made it this far. Like, just crack on, keep doing what you're doing.
Well
There's
done, you.
um, but there's no support about, well, the enormous amount of emotion that arises with a diagnosis like that, bit like cancer, the
Exactly like
grief
cancer.
for what might have been, how I could have lived life differently, or where to go to from here. So it's almost a moment to contemplate, maybe not your death, but contemplate your life. Okay, well, I've
Mm.
lived this way, and now I have this new understanding how to live your life beyond that diagnosis,
Yeah, I love
whether it be
that.
cancer.
Yeah,
So
that's right. And
that
it's similar, I remember a couple of years ago, I found this YouTube clip, and I'll see if I can find the link and put it in our show notes, around life was made up of marbles, and had this massive pile of marbles. And then as the years rolled on, these marbles are being moved away because
mm,
you've had those marbles, aka years, experiences, life. And so when got adversity comes in all shapes and sizes, and this is my opinion, and remembering, as I always say, this is mine, you take a leave. It's up to you to find your opinion around those marbles. It's like, well, rather than going, cool, oh my gosh, you've already had 56 of those, Bron. We don't know what's left, but potentially there's only this. It's like, well, yay, I've got these marbles. What am I going to do with these marbles?
mhm.
And around the gift that we all have a gift, right? We're all unique. So we all bring something to the table when it comes to contemplation of life, your death, and how we want to feel, because we want to feel it and live it. We don't want to go, geez, I wished I'd done that, you
Yes.
know?
Yes,
And
when
I
you're right.
know that, I got into law when I was like 40. And I remember speaking to a friend of mine because I always wanted to do law. I don't know why. I was speaking to a friend of mine who was a lawyer, and she worked for the DPP, and she said, oh, Bron, it's going to take you 10, 12 years before you make any money, and you're going to be in your early 50s by then. Like, is it really worth it? And I went, okay, well, maybe I shouldn't. So I didn't do it.
Mm.
Silly me. Who knows where it could have been? But it really, that around the contemplation of now, and that's,
Mhm.
I feel what you're saying is that, again, I just keep hearing this. I call them the Serenity Now moments, because it's all about the moment. It's not about the next one. It's not about next year. It's about the
Now.
contemplation of the now
Mhm.
and the what's next. And the what's
Yes.
next literally could be this afternoon.
Yeah. Well, it will be because this
It really
program
will
is
be, if you want to
under
raise
under
awareness.
under development. So, it's something I've done what I've needed to do in the sort of healthcare field, and now it's time to leverage that knowledge and apply it in new ways with some new skills. I'm doing a couple of courses before the end of the year. It's a new application of some existing skills, but it is how to live and maybe die without regret. It is contemplation of life, that there's always more life to be lived, or more iterations. embodiments to have, particularly with ADHD. Often it's about attention deficit hyperactivity disorder. And especially with women, nobody functions well or lives well from a place of deficit or disorder.
Yes.
With those sorts of things hanging over your head, there's never any attention on the incredible skills that people have, their out-of-the-box thinking, their creativity, their
Oh,
particular, you know, nuance of, the thing that they're good at because they've been told that they've failed in all these other ways. Teasing that out, bringing people back to life and letting go of the ideas of deficits and disorders and just embracing themselves
what
as
is?
what is a full and whole person and what is possible with, my skills and my brain and my particular talents rather than, trying to kind of shoehorn you into this neurotypical box. So,
Agreed. I hear
mm,
serenity all over. Like, as again, that's
yeah.
my word, and that's
Well,
what we're here for. And we're
yeah.
talking about healing, and this is healing. So I would love for you to share. How can people get in touch with you? How can they find out more about this work that you're doing and where we can connect with
I
you?
really, really, really suck at social media.
Don't worry.
And like, as someone with ADHD, it just does my head in.
Yeah,
So
yeah.
you can contact me through Messenger. I'm just Kate Caine.
We can put
You
a
can
link in the show notes,
yeah,
guys.
yeah. So Messenger, email. I don't yet have a website about this new thing, but
But
it's
we'll
going to
keep
be
it up. You will keep it
yeah.
just we'll update that. So as you come through with that, we will keep this updated. Just so you know, Kate, there is part of what we're doing is we've got it's called a fan list, which is a link
Mm.
that goes in the show notes where people can actually leave voice messages. So
Oh,
I want to
fantastic.
hear because people can talk because not everyone may be able to hold a phone, but if they can talk or someone can talk on their path on behalf, we can get messages to you. So
Wow. I would welcome any thoughts, any messages. I want people to live their life and live it fully. I think when you face the proposition that that's not going to happen, it's like an instant perspective.
yep.
So bring it on.
I do. Well, thank you, Kate. I cannot thank you enough and appreciate you being part of Serenity Rising and sharing your wisdom and thoughts around this space.
Thank you for allowing me a space and a place to do that, and thank you for creating it for others. It's been an absolute joy and an absolute pleasure.
Thank you. And everyone else, we'll see you on the next show. Thank you so much for joining me today. It's been great having you here. And what I would love you to do is leave a comment or ask a question using my fan link below this episode and on every episode that we post. I would love to hear your thoughts, your questions, and I'll get back to you. Have a great day and bye for now.